Healthy Nation. Your health, your wealth.
This is Healthy Nation, where we take Kenya's most urgent health conversations and we say them out loud with data, real stories, the people whose decisions shape your health, and a commitment to action that we all deserve long after this hour ends. Thank you so much for being with us. I'm Janet Mbogwa. This hour, one of the biggest conversations in the world, Ebola. To start us off, here's a pulse check on the same.
The White House confirming the U.S. is setting up a health facility in Kenya.
Another suspected Ebola case has hit Europe with a patient being admitted to hospital in Austria.
Ebola doesn't start the way that most people think it does. After exposure, there's an incubation period of about 2 to 21 days.
Tutapata madaraka kwa independence. Ikuaje United States wanakuja kutukontrolia nchi yetu.
Kama wataleta hiyo kitu hapa, alafu kukuwe na outbreak, we will be the first people to be affected.
Ebola isiwe na nini?
Ebola ikikuja hapa.
Kuna Ebola.
Virusi za Ebola.
Ebola isn't hard to recognize when it's at its worst.
Sisi tumekataa Ebola na tumekataa mambo haya.
So that's what's circulating. Those are the clips people have been forwarding. That's the outrage a lot of people have felt trying to understand Ebola, trying to understand the country's plans as well. And we'll delve into that. But before then, let's now go into the numbers and take a look at the data. Right? Let's see if we can bring that up because it's important that we set context for the conversation we're having. In the DRC, the epicenter of this outbreak, 1,155 confirmed cases, 304 people are dead. Now, next door in Uganda, a country that shares a direct border with Kenya, 19 cases confirmed, 2 people have died. The virus has now crossed continents. France has confirmed 1 case. A second person was evacuated to Germany for treatment. Ebola is therefore no longer just an African story. And now we take a look at Kenya, which has 0 confirmed cases, but 25 counties that are on high alert. And based on that, let's first begin with the 13 that have been classified as high risk. These are Vihiga, Kakamega, Nakuru, Kericho, Nandi, Kiambu, Machakos, Kilifi, Makueni, Taita Taveta, Isiolo, Elgeyo Marakwet, and Garissa, right? Those are classified as high risk. But then there's 12 that are classified as very high risk. And these are Nairobi, Mombasa, Kisumu, Busia, Bungoma, Trans Nzoia, Siaya, Turkana, West Pokot, Homa Bay, Migori, and Uasin Gishu, right? And right now, of course, there's no approved vaccine for this strain, no approved treatment. The only tools we have are isolation, contact tracing, and preparedness. That is a look at the reality of what the world is dealing with. I want to set the tone on what we're expected to discuss in this program and some of the guests who we have in studio. We have Terry Wairimu. Now, Terry is a psychologist. She sat with Ebola survivors and the families they came home to. Right? Then we have Dr. Peterson Washira, who was on the front lines treating Ebola patients. Later on, we'll be hosting Dr. Ouma Oluga, Principal Secretary for Medical Services, to answer questions that a lot of Kenyans still have. And then later on, Helen Aura spent time trying to understand just what it takes when a Kenyan makes that call to an ambulance service. What's the response time? What's the attitude? That feature will be coming up later on. But before all that, behind all the data is a story, a human story. Now, her name is Nalubowa Sumaya. We were able to speak with a survivor. That's her name. She lost someone through it. And with the help of her friend and neighbor, Jacqueline, we were able to spend a few minutes trying to understand her own reality with this. And I have to tell you, it was really hard to get a hold of her. She's in Mubende in Uganda. It took us hours to try and find her, to try and get somebody who can be an interpreter, and to try and get her to have the courage to share her story in whatever words that she can. Let's listen into that conversation that we had earlier with her. Thank you so much for talking to us.
Welcome.
And you're friends with Sumoya Sumaya, sorry, you said you're friends with Sumaya. Jackie, we know that you're helping translate for Sumaya. We just wanted to ask her when it was that she found out and how she found out that she had Ebola. Can you please ask her and she can tell us what happened? Okay. Hello? I know that we're having a few issues with the connectivity. Yes, hello?
That she had patients in the hospital.
Okay,
Yes. Network.
Okay, no, we can hear you, Jackie. Jackie, we were asking Sumaya, when did she find out that she had Ebola? Can she tell us about how that happened? When did she start to feel sick? Yes.
That she had patients in the hospital.
Yes.
With Ebola. That's how she gets it.
Okay, she was working in the hospital. She's somebody who works in a hospital.
No. Her relative had Ebola.
Okay, and then she ended up getting Ebola herself.
Yes.
Okay, can she tell us what happened? How did she know? How did she start feeling sick? How did she begin to know that something was wrong in her body?
Hello.
Yes.
Doctors check. That she went to doctors and they do tests.
And that's how she found out. But what was happening in her body? Was it because she started? What was happening in her body? How did she start to feel sick?
Feeling.
Yeah, how did she start feeling?
But she had severe diarrhea.
Okay, severe diarrhea.
And bleeding.
Where was she bleeding?
In the nose, ears, even her VG.
Okay. Jackie, you can also ask Sumaya when she's answering, you can bring the phone close to her mouth, just so that even if she's speaking in Uganda, we can hear her properly. So you're saying that she started bleeding, she started having diarrhea, and then the doctor told her she has Ebola. So if she can tell us, okay, so what happened? Did her husband get sick, her children? Did they have to take her? Obviously, they had to take her away from the family. Please tell her to talk to us about what happened after that with her family and in the isolation center.
Baganda bange be bakwatibwa n'abazadde bange bakwatibwa. Hello?
Yes. Yes, Jackie. How did she answer that?
That her husband didn't get it, but her parents and sisters.
Her husband didn't get Ebola, but her parents and sister got it from her?
Yes.
Okay, so, and then what happened after that? They went to hospital.
They were 6.
Sorry, go ahead, Jackie.
That she went to the hospital. She went to the hospital for 1 month.
Okay. So she was away from her family for 1 month. Was she isolated? She couldn't talk to them or anything for 1 month?
Yeah.
And what about her parents and her sisters? Did anything happen to them? Did they also have to stay in hospital for 1 month?
That she lost her sister. She was 14 years. Then others were recovered.
Oh, sorry about that.
Yeah.
And when she was in hospital, I'm sure it was so difficult. Was she scared? Was she hopeful? What was going through her mind when she had to stay away from her family for 1 month? Tell her to tell us what was going through her mind in that 1 month. Yes.
That she got scared, thinking of death, and she got pressure. She's now taking tablets for pressure.
Okay. And Jackie, how long ago was this? Which is the year that Sumaya contracted Ebola? How many years ago?
It's now 5 years.
Okay. And she developed high blood pressure because of stress, and she's still taking the tablets.
Yeah.
Okay, we have 1 or 2 more questions. How long did it take her to get better?
How long did she take to get what?
After 1 month, she left the hospital to go home to recover, or what happened?
Embeerayo nga sirina maanyi nga sirina mulimu gwenkola naye nga gavumenti yakigoberera ng'etuleetera mmere kuba twakibibana mmere ddagala nga gavumenti etutwalako mu ddwaliro naye nga tetulina mulimu nga abantu batudduka baga abantu batutukangu.
Yes, Jackie, go ahead.
That she was isolated and staying home alone. But the government take their responsibilities to take care of them.
Okay. Right. So again, just to set context of what was happening there, it was, first of all, trying to get somebody who can share their truth. And we'll find out more about how widespread the stigma is when it comes to Ebola. And then, thankfully having a neighbor who's also a friend, 2 really lovely ladies who took time in an evening to speak to us. Very far in Mubende in Uganda, trying to get the network, trying to ask the questions and get the interpretation. And also, more than that, I was really trying to be gentle because it's such a heavy conversation to have. How do you ask these questions in a way where you're also extending empathy, where you're also allowing them their own chance to remember everything that they went through? Because as Sumaya said, she lost her sister. Her parents are okay, and she has loved ones who have still survived it. She has high blood pressure as a result of the stress of isolation and everything else that went around. So we truly appreciate them. And that was just giving you an idea of how difficult it was just to have a conversation with somebody who was okay to say their story out loud. And now based on that, again, coming back to the guests we have in studio, where we'll get a bit of a medical lens, but also a psychosocial lens. And as that phone call was happening, we were already reacting with, Dr. Wachira as well as Teresia, their own experiences. Thank you so much for being here. on the first show of Healthy Nation.
Thank you.
You're the Healthy Nation #1 guests for now. I want to start with you, Terry. This is something that you saw up close. You know, you went and spent time with survivors. Talk to us about, extract more of what it is that somebody like Sumaya was dealing with, that emotional toll of somebody who is surviving Ebola.
Thank you, Janet. When it comes to a fatal disease like Ebola, definitely there must be a mental torture. Yeah, because for one, the predictability of the disease, most of the people knows that Ebola is a fatal disease. So what I would say is that in case of such an incident, people need emotional resilience. Emotional resilience means that you need to identify, in the past, you've gone through other difficult times, you faced other challenges. How did you deal with that? How did you cope with that? You need to tap on the positive coping strategies that helped you earlier on to overcome, so that you are also able to overcome the strategy, because everything begins with the mind.
That's a really powerful approach, where you would say, you're here, you've survived this, but try and remember what else you survived to get you through the next phase. Let me bring in Daktari, and I think you were making comments just now just about even the toll. You talked about health workers, many of whom lost their lives. You were at the front lines as a medic. Take us through that experience from a medical lens, but also just your own sort of like psychosocial lens.
Thank you. You know, when you're dealing with a disease of the caliber of Ebola, it's a mix of everything. And I remember then when the call came out for us to go and assist, remember I was like, what is this disease that people are fearing, that it seems that nobody can be able to probably surmount? And so I thought it would be a very good scientific adventure for me to find myself in the front line to understand the disease. But of course, I had gone through whatever was there in the social media, not in the social media, but on internet, and I understood that there were protective mechanisms. But I can tell you, it really hit me when we landed in Sierra Leone, and I remember we had very good pilots and crew on Kenya Airways, and upon arrival, they came to the cabin, to where we were, and they were like, we are really happy for you. You know, this airport has been closed for so long. We are just here to deliver you. And hopefully, and we pray to God that we will come back and take all of you. And that was the first point. And then you get into the airport. Everybody who is receiving you is in a PPE. The whole place is smelling of chlorine. And then you're wondering, what is this place I came to? But then, now, when we got in there, we were trained by people who were already doing it. We were taken through a 2-week training with simulation. And that, in addition to what we had been trained here, it gave us some good confidence. So then, after some time, of course, now we were in the front lines, and we were in all categories of hospitals, from screening in hospitals to the ETU itself, the Ebola treatment unit. So we have actually seen how these patients present. And I heard somebody say that they do not present the way people think. And I want to agree with that.
Can you tell us about that in a moment? How people present, how some don't present, and the symptoms. I know that we're having an Ebola conversation. We've been having it for a long time in this country, but I think it's important we still come back and talk about symptoms. So we'll come back to that in a moment. Terry, coming back to you, you've already talked about having to stand with the survivors from a perspective of resilience, but the stigma runs really wide. Children expelled from school, you know, you'd hear stories about people being fired from work or being told you can't come back. What does it take for our community and society to address that? Beyond the survivor, how do we carry the approach to have empathy and inclusion when it comes to people who've survived Ebola?
Well, good question. The first thing is to have self-awareness. Self-awareness about yourself and about the disease. The second thing is to have preparation plans. Suppose Ebola is reported in Kenya. How do you respond to that? You need to know how it presents and preventive measures. And also you need to know whom can you call. Do you have emergency contacts like 112 or 1199, whereby you can call somebody and come and rescue you? Strengthening social cycles, the people around you. You don't have to have very many friends or very large social cycles, but you need to know which friend can you call, and if in case a family member got the disease, how do you handle the family member without stigmatizing them? Because you are social beings, and these things will come. And we know that we can tap from the people who have survived. How did they survive? We need to put preventive measures in place, like doing self-care, and also having a positive attitude that others have preferred through, we can also prefer through. Social stigma can be very bad. It can be very bad because that is the time the person needs support from the social cycle, from the family, and we need to know that. We need to embrace them and understand there are things we cannot change. If pandemic hits, you embrace the difficult times and know you do not have control, but you can put in place the preventive measures like doing self-care.
Let's pause there. Sometimes I feel like it's, imagine if it comes. You're saying we can put the measures in place. Now, you were saying, Dr. about presenting and how it presents. Continue with what you were saying and then just talk to us again about the symptoms. What people can look out for,
Thank you. And it's good that she has said that we should prepare. And let me say that we are not at a bad place. The fact that we don't have a case and we are discussing preparedness and we are preparing. In fact, the biggest lesson we learned in West Africa is you should prepare before you have a case. That is what makes difference. So when a person contracts Ebola, depending on your immunity, first you have an incubation period. And what an incubation period means is that you are not going to have symptoms during this time. And that means the person who is infected does not know they have the disease. And that is why you need the screening mechanisms. And that is also why we are saying that somebody can be infected in Ituri, at Raqqa, they can come across Kenya and go to Tanzania, and they'll get the symptoms when they are going back. So within the 21 days, you can get it from the 3rd day to the 21st day, depending on your immunity. Then after the 21 days, or let me say, after now you have started the symptoms, you are going to get very unspecific symptoms that you can get with any other disease. Conjunctivitis means redness of eyes, you will have muscle pains, you will be tired, you don't want to eat, you'll have a sore throat, a little bit of fever. That is something that you'll have with any other disease. And that is why we need to train our health workers, and especially the front line, the ones in the OPDs. If you look at the statistics in West Africa, where we lost around 531 workers, that were doctors. We had 170-something nurses. The others were clinic officers, 306 were clinic officers or equivalent, and the lab people. And so you can see where the infection in the hospital will come from. It's the lab and in that consultation.
Right.
So after now you get those unspecific symptoms, also depending on your immunity. They can last from anything to hours to days or to weeks. And then you're going to have what we call the wet symptoms. And from the time this person has symptoms, even if it's a sneeze or a cough, they're infectious.
Okay.
But when you get to the wet symptoms, which basically means you're having very high fever and profuse sweating, you are having diarrhea and vomiting, and basically you are losing a lot of fluids from your body. Those fluids are very, very contagious. And many people would die at this stage. And because of the cultural practices, people would contract from this. Then after the wet phase, that is when now your organs are going to shut down, including the liver and now you are going to get the bleeding tendencies. Yes.
All right. For both of you, because you've spoken well about the symptoms, and like I said, this is a conversations we've been having over the last few months. You've spoken about psychosocial. Both of you are talking about preparedness,
yes,
which is a great place to be as a country. But say there was a case today, and maybe I'll start with you and then come to you. Yeah, first of all, what is the gap between what is being said and what's on the ground? Because we are going to speak to government about how they're saying, no, we can handle this. You're at the front lines, Daktari. Are we ready? If this thing happened tomorrow, what happens?
What I would say is that, and I've said this, that we really need to fast-track training of health workers. And, the weakest link will be if that nurse, that clinic officer, sitting there in a dispensary or health center, if somebody with these symptoms is going to come to them and go back home without them suspecting that this person might be having Ebola. So your first link, leave alone the isolations and whatever we are talking about, is do our health workers have this knowledge to be able to pick up this case? Because if you don't pick, this person goes back to the community. They infect others. By the time you know it's Ebola, you already have a ring of people who are being infected.
And is that something that's currently being pushed for in terms of where you are now? The question is, right now, do they have that knowledge? Can we handle it?
The training is happening, but it's not as fast as we would expect, and especially in the highly risk counties. And of course then, when you have that, and when you have trained health workers, they're the ones who work in hospitals. It becomes very easy to establish quarantine facilities. By the way, quarantine facilities, we cannot say we don't have quarantine facilities. That can be done even in a high school. It's the isolation facilities that now you need a facility that, of course, will be secure and where you do not expect that people can be infected. You have the protective mechanisms. We already have an 8-bed hospital in KNH. We have a few. I was involved in the inspection of facilities, and I can say that a good number of them, they are not prepared well now, but they have designated areas where they can establish isolation facilities. And that is why I'm saying we are at a good place as a country. One, we are having a conversation on ensuring that our health workers get the training, and that we are having a conversation on setting up quarantine and isolation at this point. It means that if it lands here today, we will know what to do.
Okay.
Yes.
Your reaction to that? He's talked about it from that medical perspective. Very briefly, from that psychosocial perspective, the case was to start tomorrow. Daktari is now trying to deal with the caseload. You're now having to deal with talking to the country about psychosocial support. Talk to Kenyans about the mind frame that we should have.
Yeah, what I would want to say is that people should get the right information from the relevant authority like the Ministry of Health. Yeah, because there are bloggers in the media who likes fabricating stories, causing a lot of anxieties and fear about what is not right. Getting the right information is very paramount, and then try to reduce watching distressing news all the time, because you're going to feed your mind with fear and a lot of anxiety. Right now, we do not have the disease. So you need to constantly refrain from observing distressing news, always about the deaths, always about the new cases in DRC and Kampala. You need to build mental resilience. Right. If the disease comes, how can I handle that? Okay. And I said earlier on, how have you been handling the difficult times? What coping mechanism do you have? What preventive measures do you need to, like self-care? Nobody who can take responsibility of your life. You need to feed your mind with the right information. You need to take precautions.
Right.
And we also need to engage the community.
Early enough.
Yes, especially community health workers, so that we can use them to go and lead the right information to the community.
Thank you so much. Terry Wairimu and, of course, Dr. Peterson Wachira. We're going to take a quick break. We're going to look at the highlights. Later on, we're going to take this information and ask government, with all this, what happens next? We'll be right back after this.
It's a fast-paced game where a short part of the Bible verse is displayed on screen and you must quickly guess the full verse. Again, mwachia.
But
Jesus wept. Please, msifanye hiyo mchezo.
Nini?
Ni Bible. Nini?
Verse?
Of which one?
John 3:16 so acha nimalizeni nipate full points. For God so loved the world that he gave his only begotten son, that whoever believes in him shall not perish but have everlasting life.
And then Psalms 3:15. Psalms 3:15. Kwani mtanifanya nini? 23:1. So half for Psalms and half for the shepherd. One, good.
If you picked up a 1,000 note today, what would you do? A, take it to the chief.
Today?
B, take it to your mother. Number 3, give your friend who is in need. Number 4, report to the nearest police station.
Pray for the guy that is going to be well. Then if this one doesn't...
I love chief afanye.
The next Bible verse.
It's Beats and Buzz. Weekdays from 4 to 6:30 p.m. only on NTV.
Kikapu kibonge, kikapu kibonge, kibonge. Naivas says your money. Kila siku every day. Kikapu kibonge, cheza kibonge. Homo value. Naivas. Hiyo ndo se. Kikapu kibonge, kibonge. Quality juu, bei chini.
Visit your nearest Naivas Key local or shop online for more and save big. Naivas saves you money.
Renewed Molfix is now even more absorbent with double-layered upper surface. Only 20 Kenya shillings, single-piece Molfix at your duka.
Sour fresh, niko sete, niko fine, niko best. Sour smooth, sour fresh. Usiku mchana glow bila stress. Sour smooth, sour fresh. Niko sete, niko fine, niko best. Como si te conociera de otra vida.
Renewed Molfix is now even more absorbent with double-layered upper surface. Only 20 Kenya shillings, single-piece Molfix at your duka.
Niliambiwa siku ya game, kama uko na rafiki gani kwa Gor Mahia, don't say hi.
There's a lot of pressure when it comes to derby. It's not just another match you're going to play. What's at stake? Bragging rights.
This is about pride, a match, a derby that has been passed from generation to generation.
There are coaches who would want you to do a few things that we never liked doing.
They used to say, if you had a firstborn son, don't usonge karibu na team.
Nishaona coach ako na douche kwa mfuko. Si tumeka kwa bench unasikia chui anainyonga hapo.
Witchcraft was purely psychological. Not all players were exposed. No.
Even the current crop of coaches do it.
Can you imagine these guys even had a budget for that?
When they came with that stuff, we also did other things to counter that stuff. Kuku anawekwa kwa maji, alafu anasprinkliwa maji kwenu. Ukikataa pia ni maneno.
Usifanye kana kwamba uchaguzi bado unaendelea, umekwisha. Kazi nzuri walioifanya ndio mafanikio tuliyoyapata. Nilipofika Rais Kibaki akaniambia mambo mawili. Kwamba nisiondoke, kwanza nimwambie Kofi Annan asiondoke. Maana katu alikuwa ameshavunja mazungumzo. Na aliyeniletea ujumbe Moses Atangura.
Kwetu ni mzito sana kumwambia rafiki yake mapema kwamba wewe bwana unakosea, tunaharibu hii kazi.
Nina Samia.
You feel that? The crash zone.
Crash what?
The crash zone. It builds suspense, uncovers evidence, foreshadows danger. You feel it now?
Oh yeah.
I guess I'll go and try and find a ladder.
Healthy Nation. Your health, your wealth.
Welcome back. Thank you for being here for the inaugural Healthy Nation show on NTV. The hashtag is Healthy Nation NTV. You can also talk to us on our digital platforms. And we are going to be tackling big health conversations on this platform and also big themes: health justice, health equity, the fairness of access to health. But today we are narrowing in a little bit to Ebola, a conversation that's been a massive global one. And we're talking about preparedness, talking about the pushback that Kenyans felt they had to protest against the opening of a facility and saying, are we even prepared if this disease comes? Dr. Omo Oluga is the Principal Secretary for Medical Services. Yes, and he's here today. I'm saying that because he's been trying to say, Janet, set the agenda broadly.
Yes.
Why are you narrowing it down to Ebola?
Yeah.
Why is that important to you? Because I think, yes, we're setting the agenda broadly, but this is a huge, important conversation, don't you think?
You know, on a day-to-day basis, Janet, I engage with Kenyans. I am very privileged to have been in this sector for 16 years. All of that really facing stakeholders. I was a student leader, I was a union leader, I was a CC in charge of health in Nairobi, then now Principal Secretary. So I've always been representing people. This my phone on a day-to-day basis. The Kenyans who reach out to me are reaching out to me about three things. It's either a health worker who is wanting some clarification about how they can be enabled to work better. Or it's a county or a hospital who is trying to get clarification on how they can work better with SHA. Or is a citizen that has a bill in a hospital or is seeking some help in a hospital. I know that these conversations around Ebola, around disease outbreaks have also been a concern. But on a day-to-day basis, and I can tell you, I have quite a bit of context. And then so when I come here, I want to try and address that young man who sent me the bill of his mother in a private hospital in Kisumu, says these people are charging me 531,000. SHA is paying 150,000. Isn't this 150,000 for SHA enough? And so that is why, for me, and then now just to crown it, this is also the reason why health now is one of the 5 key pillars of this administration. So really that's really the argument. And I'll pause there because fair enough. But I think one of the reasons we also thought it was important to having this conversation is because there is a massive gap in our healthcare system. Now, fair enough, we can say, yeah, globally there's a lot of countries. But right now, and that's why I talked about health justice and health equity, there shouldn't be a case where somebody says, I have to pay this and this is out of pocket. And I know as the PS, you'll say, we are working on, we've hosted you several times. That's what I wanted to In fact, I'm the one who brought that agenda.
Yes, we'll come to that, But we also cannot go away from Ebola. So why don't we use Ebola as the example to then feed the broader agenda? And I have to start where you've talked about it before and we've seen it discussed, which is this very big controversial decision about the facility. When there's 0 cases, why would a government feel the need to say, no, we can tackle this? We can have a facility here to make sure that we're quarantining people and Kenyans are going to be safe. Nobody's going to be infected. To date, nobody understands why that decision was made.
Which decision? Sorry, let me clarify.
We saw the protest happening in Laikipia for that facility. And I know you've addressed it before. But the decision to accept, being able to say, yes, we'll accept this funding to then open this facility in Laikipia to make sure that we're containing people who have Ebola when we don't have a crisis in the country. That's something that for the ordinary Kenyan, a lot of people did not see how that makes sense.
Yeah, and we do understand. You know, so first of all, I think barring any prejudice in terms of discussing a court case, I think what I would say is that we do understand the concerns that Kenyans brought forth, and we are quite familiar with this territory. And you know, for me, again, I sit here as a principal secretary representing government and doing this administrative work, but I'm also a specialist. You have just hosted Washira, who was here, who was in Sierra Leone, and the lady who was in Liberia. I was in the DRC, Congo, Rwanda in 2013. I am a specialist of infectious diseases. If you go to Makerere University, check the list of the people they have trained on fellowship of infectious diseases. Dr. Umo Luga is there. And you can check how much I scored and what was my number. So basically what I'm saying, so when I sit here representing the government, but also have a professional voice. And any doctor anywhere in the world can look at it and say, is this guy saying the truth? And this is what I was telling my good colleagues, Davji and all of this, my friends, you know. I have been in the forefront with Ebola when there was no vaccine, when there was no treatment. Right now we have the Bundibugyo strain, which doesn't have a virus, doesn't have. When I was in the Rwanda-DRC border in 2013 October, there was no vaccine and there was no strain. I was not there to sign papers. I was an infectious disease specialist responding. And I was not just trained on Ebola. I was trained on Marburg. I was trained on all these things. So basically what I'm trying to say, and we were many of us, we were 90 Kenyan doctors that time. Then in 2014, 2016, Washira and his team were 157.
Yes.
In total, we have 304 Kenyans who have been out there well trained, like myself and all these colleagues. Then we have another 3,000 people that we have now trained here locally. Then we have isolation centers. We have 8-bed isolation capacity in KNH. We have 49 bed, the police hospital isolation. We have a 20-bed isolation, ICU grade isolation at MTRH.
You're giving this data to justify.
Basically, I sit in a position, this is what I'm saying. So I see everything because I work on behalf of Kenyans from this administrative position, but I'm also a specialist. So from all angles, I can clearly say that we are strong enough. WHO scored us. You can look at this.
That's fair. Let me interrupt you to say this. People died protesting this. And the reason I bring that against even the data that you're sharing is this is what Kenyans felt. You didn't consult us. You didn't explain this to us. And what we see globally is already countries struggling with preparedness and death and all of that. So I think the biggest thing is we feel played. You did not consult us, and therefore we had to take to the streets.
And I started by saying, we understand what Kenyans are saying. I also started by saying that we know that we should work in an environment where everyone walks the same journey with us. I'll get you a little bit out of Ebola. Do you know why we always work around vaccines? So right now, public health has become such a huge political, problem all over the world, that poor perception and misinformation is the greatest barrier we're having. And it's not just about vaccines. It's about Ebola. It's about everything. And so from that perspective, I do understand that we really have to engage with the public. And so I think on that note, we've really tried to say, okay, things were moving very fast. We have a responsibility. We have a responsibility to protect the Kenyans. We have a responsibility to ensure our healthcare workers are prepared, because Ebola will not come to Laikipia. Ebola will show up in Mombasa. It will be a nurse in some private clinic.
Who will be
and somebody will just show up with a headache. And that is the
So do you admit that the way in which you were collaborating with Kenyans was wrong? Is there anything you regret, Doctor, about how everything was handled that led to this court, to the decision made by the court? Is there a part of you that says, I think we could have handled this differently?
I think things were moving very fast. I don't think that there is anything that we could have handled differently. I came out, I spoke. I think my video is out there. There was a lot of backlash. But what I said stands. As I mentioned, I'm a professional. I'm a doctor of international repute, by the way. So,
Dr. You've told us this several times. We know this.
And what I'm saying this is so that everything I say, you can judge it. Forget about the politics of the day. Forget about the government. You can not like what the government is doing. But look at the professional thing Dr. Luga said. And I'm putting me as a professional, so that any doctor, anywhere in the world can look at what I said and comment and say, oh, he was wrong. So basically, we came out, and I think we had a responsibility. And I think we have come out before. But things were moving very fast, because I think from that perspective, we had to work at the global level, at the continental level, His Excellency the President chaired a meeting with all the ambassadors. We had a meeting at the Africa CDC with all the ministers in Africa. And you see, what happened is that you have a meeting today at 4 with all the ministers in Africa. Tomorrow morning you have to take an action. You understand? And so you are caught in between this time period of intervention to again protect Kenya, protect the entire continent, because these are collaborative efforts.
Right.
You understand?
Yeah.
So we had this meeting under IGAD, we had the meeting under Africa CDC, we had the meeting under WHO, and so all of this.
All of those factors mattered.
Yeah.
Can we talk about the screening protocol at JKIA? Because, you know, again, this is what happens at the airports. That's exactly where the scare is. Talk to Kenyans right now who are saying any minute now, there's going to be a case because the airport is the easiest way that this comes in. What are the screening protocols? Talk to Kenyans about how prepared we are at the airport.
We have 26 points of entry, and what we are trying to do is to make sure that we have a screening protocol, of course, as you mentioned. It's a very simple thing. We check temperatures, we check where you've come from. For people coming from Uganda and DRC, they come in through Gate 16. And that is to make sure that there is a bit more attention. By the way, Kenya has been scored 100% on contact tracing because of how we are doing the screening. We've also been scored very highly on rapid response in terms of how we respond to any case that we think that we may have to isolate, confirm. So far, we've had to do around 161 tests, but in total, we have had to screen 161,000 people, you know, coming from Uganda, from the DRC. We don't think that that there is any cause for alarm. We don't have any case. We're doing very well, and I have just been on call with my colleague from Uganda, PS Diana Antwin, and they are doing very well. So every day we're collaborating. We've had a number of other ports of entry where there was some scares, like in Eldoret, was in Gishu, in Garissa, and in many other places. But so far, out of the 26 points of entry, particularly you've mentioned JKI, which is just one of them.
Right.
We've put in a lot of protocols, the measures.
So you say we're doing well. And this is the question I asked our guests earlier, was if a case came in today. When you say we're doing well, talk to us about that preparedness across scale, whether it's the isolation facilities, whether it's the screening. Dr. Or rather Peterson Washira did say, because I asked him the same question, he said, no, I feel like as clinical officers and as healthcare workers, we are training them and we're trying to make sure that they anticipate it.
Yeah.
I don't know how much of a comfort that is to a Kenyan who's alarmed listening to this. So talk to us about if a case came today, which number do people call? How do people react? And what does it look like to contain it?
So we've had *719# that you can use. It's a call center that we've used from the days of COVID, and it's specifically on issues of disease outbreaks and this kind of problems. And so that is what I'll tell people, *719, or you can just call 719 to reach out. And as I've mentioned, the most important thing is high index of suspicion, both in the members of the public and also the health workers. So far, we've trained 3,900 healthcare workers, 414 in person. But out of the ones outside there, we've trained around 3,009. We have a surge capacity. Surge capacity means that we have people who we can call at any time to respond. As I mentioned, we have 304. People like myself, people like Washira, who are specialists, who have seen real cases. You know, there are many healthcare workers. Kenya has never had any single Ebola case. We are working extremely hard to ensure we don't have any single case. And I think when I say we are prepared, I think people misinterpret to mean that now we can have Ebola. No. What we are saying is we will do everything under the sun to ensure we do not have any Ebola case in Kenya, okay? But should we have any, okay, we don't want to be caught flat-footed.
You don't want to be caught unawares.
And unawares. And that is the most important. And so we are training our healthcare workers to also have very high index of suspicion because Ebola will not show up in Busia, as people think. Ebola will show up in some clinic somewhere in Taita. you know, somebody who was, you know, traveling, maybe is looking for minerals in DRC and is gone to look for minerals there. Some construction site here where somebody is selling tea and, you know.
Not the places you'd always expect.
Not the places you'd always expect. So high index of suspicion among health workers, high index of suspicion among members of the public. And that's why this is such a whole of society effort. That is why it is so important that we are on the same page with every single citizen.
Yeah, and speaking of that, I want to step a bit away from Ebola as we wind up. When you talk about being on the same page as every single citizen, you know, Doctor, one of the reasons I wanted to do this kind of program was I have been, and as many people have been, it's been very hard to see healthcare on very shaky ground. Because each one of us is an incident, a disease, an emergency away from either not being able to afford healthcare or not feeling like a priority. It almost feels like the way the Kenyan healthcare system is set up now is that some people's health is more important than others. That's why Healthy Nation was important for us to do. And I know we'll have you back several times. But Doctor, it doesn't feel like there is a general consensus from Kenyans that their health justice is being taken seriously. And I don't know where you can start to allay or assuage those fears to say, we hear you, we hear your frustrations around SHA, we see what the issues are with accessing emergency services, we hear you. Kenyans don't feel seen and Kenyans don't feel heard when it comes to accessing healthcare.
No, I'll flip it. I'll say that there is a lot of progress that we've made. There is still a lot more for us to do. And that a lot more for us to do shows up every single day. It shows up in the form of complaints. It shows up in the form of people who haven't been handled well. And I'll tell you the work that we still have to do. So health is one of those big agenda for this country, among the 5, you know. And under health, we have these 4 key interventions. One is health financing, which of course we have established the Social Health Authority. We are very keen to make sure that every single citizen does not get poor while accessing healthcare services or does not die because they can't pay. And then so that's the big things. Today, if you had cancer or if you had a problem that required dialysis, even if you're employed, you will spend 1.1 million a year. And that is something that has made either people die. Now, when somebody dies, children are left. The government still has to spend on bursaries and all of those kind of things. The shop they were running can no longer be there. So we are trying to prevent the big things that make people die, but at the same time, the big things that make people poor. That is why you see we've put 800,000 on cancer. That's why you see we've put 1.2 million on transplant and on dialysis. That's why we are putting maternity shouldn't be a big deal, and we are financing it 100%, you know. So the things that are important, making Kenyans poor or making them die. And that is what we've prioritized in the benefit package. But there is still a lot more for us to do.
And and also for it to show. So I also want you to speak to what's on the screen. Ebola imefika France na Germany. Why is screening only for travelers from Congo? That's Collins from Siaya.
Yeah, but the screening is the way you tell. So there is, so how you screen. So first of all, the screening is done from where the risk of where you're coming from. Okay, and the contacts that you've had. And then secondly, in terms of what you're feeling, you know, and what you felt in the last 21 days and so. And then thirdly, of course, there is the extra measures we can go in terms of tracing you or sometimes even, you know, quarantine if need be, if there's a risk, okay? And so far we've not had to go the extreme measures. We've had some highly suspected cases, as I'd mentioned, which we've tested, which are all been negative, you know, and some we've done even repeat tests. So I think so far we are okay. Now, just like Ebola has gotten to France or Germany, high index of suspicion. Collins, high index of suspicion. Kenya is not immune. We are not an island.
No, absolutely. I think Kenyans are just thinking of preparedness. Doctor, I think we'll leave it there. We're definitely going to...
We have a big conversation.
We have a very big conversation that we need to...
about the health financing, health workforce issues, health products and technology,
we'll bring you back.
And digitization. Because if we don't tackle all those things, then we cannot sort out the problem that the Kenyans are having.
that after...
We've made a lot of progress.
Right.
For the first time, we don't have a vaccine problem. You've been covering news forever. Every single year, you've been talking about vaccine shortage.
Yes.
This year, you've not talked about it.
We'll leave it at that for now. Doctor, we'll leave it for that for now.
This
yes.
year, you've not
No,
talked
there's a
about
pending one. I think the permanent and pensionable is still an issue.
And we've just sorted out that.
Right. So we're going to pause there. Clearly, with Dr. Uma Oluga, we need a whole other... But thank you very much. We'll bring you back.
Thank you so much.
There's something else that Kenyans have to always or oftentimes worry about, and that's emergency services. What happens when you call for an ambulance? You're in the middle of nowhere or you're in a far-to-reach area. What does that process look like? Who gets picked? Who gets left behind? Helen Aura took time to find this out. Let's listen in and then we'll come back and react with Dr. Uma Oluga.
In that moment of emergency, who is your first call?
Hello? I need your help. It's an emergency. Yeah, it's an emergency. How soon can you get here?
Do you know how to get an ambulance in the heat of that urgent moment? For many Kenyans, the immediate instinct might not be to call an ambulance.
Niliita mtu alikuwa karibu na mimi, akanipeleka hospitali.
Mimi naitaka jirani ama watu wangu. Wako karibu na mimi.
Wakati mwingi shughuli za ambulance hapa Nairobi ni ngumu kupata. Na iwapo utapata na kuwa itaweza chelewa kufika.
But Kenya has multiple emergency contacts depending on the service provider, while 999, 911 and 112 are recognized national emergency numbers. Many counties and hospitals also operate separate ambulance hotlines. Now let's put the theory of how to get an ambulance or just emergency help to the test. I made a call to the emergency numbers, which even the police share as emergency contacts.
Sorry, you are not allowed to make this call. Please contact your system administrator for assistance. Sorry, you are not allowed to make this call. Please contact your system administrator for assistance.
Some of the emergency numbers provided were not going through.
Welcome to the National Police Emergency Helpline. Press 1 to talk to an officer.
Then it became a waiting game.
Halo, habari ya leo?
Nzuri.
Naomba usaidizi, naitwa Beth.
Yes.
Niko na rafiki yangu ameanguka hapa town. Tunajaribu kutafuta access to ambulance services. Kuna vile mnaweza tusaidia?
Every minute lost can significantly reduce a patient's chance of survival, particularly in dire cases. This could have been a morbid situation, and for many, unfortunately, it is not a test or a simulation. The Health Act of 2017 stipulates that every person has the right to emergency care, which comprises pre-hospital care, stabilization of the patient, and arranging of referral in cases where the health provider of first call does not have facilities or capability to stabilize the health status of the victim. The law further states that any medical institution that fails to provide emergency medical treatment while having the ability to do so commits an offense and is liable upon conviction to a fine not exceeding 3 million Kenya shillings. Kenya has a national policy dubbed the Kenya Emergency Medical Care Policy of 2020 to 2030, which guides ambulance and emergency medical services. Despite the existence of the policy, implementation remains a key challenge. Kenya still lacks a fully operational single nationwide ambulance dispatch system. SHA says that it will soon be launching a national dispatch center where one is to call 112 and get an ambulance dispatched to attend to the emergency at no charge.
Public education campaigns will now be critical to ensure every Kenyan understands how to access emergency services and when to seek medical intervention when urgent. Helen Aura, NTV.
Thank you so much for that, Helen. Daktari, your quick reaction to that.
So this is one of those things that we have to do to stop Kenyans from dying or from getting poor. Because when you get an accident, it doesn't matter whether your salary is $1 million or 10,000 or you are nobody. You depend on a state to do something now. Through the Social Health Authority, we are setting up an ambulance dispatch center. I understand this very well. His Excellency the President has already put 8 billion through the Emergency Critical Illness Fund.
We're going to put a pin on that.
Which we are going to
That's a conversation we are going to follow up.
Yeah,
we're going to hold that with it. We're going to put a pin on it and come back.
It has delayed because of county governments. 12 ambulances have already been given from Nairobi.
Okay,
we already have put in more
Doctor,
than around
we will invite you. When we were listening to Helen, we said he will come back and have a baraza with people. Thank you very much. We do have to sign off. Thank you very much for coming on the First Healthy Nation show. There's a few people on YouTube as well asking questions. We'll make sure to get your feedback soon. But I want to sign off now, and I feel like I want to hold your hands as I say this, Kenyans. No Kenyan is more than one diagnosis away from financial ruin. Dr. Uma Oluga has just said that. One emergency away from losing everything. One disease away from a system that isn't necessarily built with them in mind.
It's built with them in mind.
Okay. And this is not just Ebola. This is an ordinary Tuesday. That is the mother who cannot afford her insulin. That is the father who waited 6 hours for an ambulance that didn't come. Now, the child sent home from a clinic 3 times before anyone caught what was wrong. Ebola is simply the moment we can no longer look away. And this show exists for every moment before that. Every Sunday, we'll be here asking questions and demanding, of course, for answers and also trying to get a better understanding of what government is doing. Dr. Uma Oluga says we are doing a lot. When will we begin to see how it works for Kenyans? Thank you so much. That is my sign-off. Thank you for watching Healthy Nation every Sunday, 6 p.m. on NTV. I'm Janet Mbogwa. Have a happy, healthy week, and I'll see you back here next week. The news is up next.